Hello, I'm Jennifer Dankers, and I'm a member of the Comprehensive Heart and Vascular team at Mid-Michigan Health. As a certified nurse practitioner, I'm also the coordinator of Mid-Michigan's Heart Failure Clinic. Heart failure is a condition in which your heart's pumping function is impaired. It is the #1 reason for hospitalization for people who are age 65 and older, and affects nearly 6 million people in the United States. Without a heart transplant, this disease has no cure. But with proper care and treatments, heart failure can be successfully managed. Many patients with heart failure are very active and able to do most everything they wish. There are 2 forms of heart failure: a weakened pump that's unable to move blood out to the body, or a stiffened heart muscle that does not relax and fill with blood properly. When the heart is weakened or stiff, it is not able to pump enough oxygen and nutrients out to meet the demands and needs of the body. Therefore, most heart failure patients have symptoms of fatigue, shortness of breath, all with minimal activity. With heart failure, pressures build up in the failing heart and can cause increased pressures to build in the lungs. This can cause fluid to leak out of the blood vessels and into the lungs, where air should be. This creates symptoms of cough, difficulty breathing while lying flat, and increased shortness of breath. In an effort to compensate for the failing heart, the kidneys often respond by causing the body to retain fluid and sodium, ultimately making heart failure worse, and the fluid and pressure of the veins in the body build up, causing swelling of the abdomen and legs called edema. It is important to note that heart failure is not just a simple state of fluid overload. This disease is a progressive problem that has many periods of stability marked by episodes of instability. And left untreated, heart failure is likely to cause significant limitation in your activity level and quality of life. There are many causes of heart failure. Some medical conditions that result in heart failure include coronary artery disease, high blood pressure, diabetes, sleep apnea, heart valve disease, heart rhythm abnormalities, and some viral illnesses. If you or someone you know is suffering from heart failure, Mid-Michigan Health's Heart Failure Clinic can help improve your quality of life. Our program is designed to assist patients in monitoring responses to treatment, modifying behaviors, adjusting medications, and coordinating care with your cardiologist and primary care provider. For more information or to inquire about becoming a patient, please call 989-832-0900. Hello, I'm Jennifer Dankers, and I'm a member of the Comprehensive Heart and Vascular team at Mid-Michigan Health. As a certified nurse practitioner, I'm also the coordinator of Mid-Michigan's Heart Failure Clinic. As part of the planning phase for our clinic, I was able to personally collaborate with the University of Michigan Health System to gain insight into the intricate layers of their successful heart failure model. This firm base of knowledge was then used to build Mid-Michigan's Heart Failure Clinic, with the goal of helping heart failure patients across the middle of Michigan live longer, feel better, and spend less time in the hospital. Our Heart Failure Clinic provides patients with comprehensive education and counseling on chronic disease management that is tailored to the individual needs of each patient. We also provide assistance with establishing a medication regimen and monitoring the effectiveness of medication therapy to improve symptoms. Instruction on self-care behaviors such as establishing a low-sodium diet, a regular exercise routine, and monitoring daily weights is essential. We also provide prompt follow-up after discharge from the hospital and also after periods of instability. Care coordination with the patient's cardiologist as well as the primary care providers. Assistance with monitoring the signs and symptoms of fluid overload and other heart failure-related conditions to avoid the need for emergency room visits and rehospitalizations. Easy access to the comprehensive heart failure team and quick responses to questions and concerns. We also provide assistance with social and financial concerns. Our team also collaborates with other specialists as needed, such as an electrophysiologist to manage an irregular heartbeat or provide cardiac device therapies, which may be used in some patients to treat symptoms of heart failure. We provide assistance with referrals to advanced heart failure therapies, including ventricular assist devices and heart transplants when necessary. Ongoing support is provided to the patients and their caregivers during the transitional period from disease-treating therapies to therapies and referrals that will ensure comfort in the end of life. I am excited to be able to be part of the advances in cardiology and heart failure care within our community. It is an honor to serve my heart failure patients through the Mid-Michigan Heart Failure Clinic and create individualized care plans to support my patients as well as their families. For more information or to inquire about becoming a patient, please call 989-832-0900.